Let's move on to question 2 if we could. So question 2, how will an accrediting agency know if an added topic or new criterion actually improve the quality of education? Should there be some sort of litmus test? So spend 10 minutes discussing this question, and then we'll regroup again. Okay, let's go ahead and regroup. Sounds like there's some, again, some really good conversations. Sorry to have to interrupt given the time constraints. So thoughts on this question? Sorry, please.
Seems easiest. So we actually took 2 roads to answer this question.
Get a little closer to
We took 2 roads to answer this question. We initially interpreted it to say for an individual program, if you've gone ahead and required a new criterion, how could you measure improvements in quality? And I think our collective thoughts on that were you might require the program to have a process in place to evaluate quality themselves, not a specific metric of quality, but that the process was required. But then we actually took a step back and said, well, is this actually asking if the accreditation agency required this across the country in an aggregate view, how would they measure quality improvement? And there we had good, I think, discussion and debate that in the short term, you might still go back to see if programs in aggregate have process evaluation. But in the sort of medium and longer term, as you reflect, you might see changes in the scope of practice of a profession. You might see practice analysis changes. You might see, hopefully, health service delivery environment changes. So there were sort of 2 angles to our discussion. Did I miss anything?
Yep. Okay. Yeah, please, Miguel. And then Pam.
Reporting from table 4, and we've become a very introspective group, I think, and we've actually even come up with more questions. And I think the first thing
Are you going to answer those over lunch?
Accrediting agencies, would they really be the first to know the answer to this question? And throwing it back into the environment. And we would almost rephrase this question to say that the criterion should actually not focus on the quality of education, but the quality of care. And that's something that came up for us. So, and then the last thing was how we define quality. And number 1, again, should we be defining quality, or should it be the actual people that we serve? And looking at models of quality definitions like Toyota, looking at triple aim, and so on and so forth, that there's so many things out there. Which ones are the most meaningful to the patients?
Miguel, can I push you for a minute? So how would you link the quality of education with the quality of care, given that there is some growing evidence that those 2 are intertwined?
And that's where we actually came full circle back to that we could not actually divorce the 2.
Okay.
That they were both equally important and mutually dependent.
And would you measure both?
What do you think, group? Yes, of course we would. We're deliberative.
As you work at the national board, I'm glad to hear the answer.
Very deliberative process.
Pam.
So just to dovetail on that, we also said quality education is about delivering quality care. So we had that dialogue too. And also to even answer we said depends on the topic. You have to have other questions, just what this group said. Who judges the quality of education? How do we measure the outcome? Also, we talked about adaptive testing. There's different ways. I know in nursing, they have computer-based and adaptive testing. So many items are given to prove that you have competency in this area, or more added. We also brought in, when we talked about quality of care, and somebody said, what about the patient and client in measuring the quality? And a little dialogue about that. Can patients really judge? Some things they can, some things they cannot. That's where the practitioners become important in the regular accreditation bodies to know that performance. Talked a little bit about knowledge, skills, and attitude. Those are all measures that probably go into quality education, quality care. And also the fitness for purpose, fitness for student progression, all that. So anything to add, group?
Great.
More questions and answers.
Back to, I can't see your table number in the back there. 2, that's okay. That's perfectly fine. It's nice that you were actually not looking through the site. Please.
Thank you. I think the one thing we added in relation to the clinical patient care piece that we agreed the practice piece was so important is we would actually have the same topic criteria threaded through like joint commission. And if that is already the process on the practice side, then taking this one topic and starting from education and moving it through.
Great. Maria.
Maria Tassoni from the University of Toronto in Canada. So to the question of should there be some litmus test, our response was yes, but you can't always wait to have the full robust set of litmus tests. And sometimes you just have to start building the bridge as you walk on it. And we talked about the idea of the tried and true from the diagram earlier this morning, and reflecting on pedagogy that we think has been tried and true, like problem-based learning or case-based learning, and yet 30 years later, there's actually no evidence beyond level 1 Kirkpatrick that it works. So it's tried. We don't know if it's true. And so just a reflection on what is tried and true was kind of an interesting conversation. So not waiting until you have everything sort of perfect, but recognizing that you have to build in the measurement and the evaluation up front, perhaps starting with some more proximal or process measures as you move towards some of the more distal outcomes. And then looking at different kinds of testing approaches, both qualitative and quantitative. And I think a recognition from our accreditors at the table that the accreditation community has been really good at the assurance piece, but that moving towards the improvement and quality piece is a challenge, and really about a culture shift that involves all the stakeholders we've been talking about.
Yep, great. Any other comments on the tables? No? Okay. Well, why don't we go ahead and wrap up then? There's a couple of, I think, really important themes that came out this morning that I took down. Again, feel free to jump in, but one was that it's not enough just simply to identify a topic. You know, that feels like on the surface an easy thing to do. I think what we heard in that first question is that you really have to think about all the stuff that surrounds it, and also really think about what is the accreditor's role in the implementation piece. And, you know, her different kind of feelings about that, about should they at least provide some guidance on what the pathway looks like to implementation? Do they just put it out there and let it, you know, drive from the community up? There are different ways of doing that. So I thought that was an important theme. The other, particularly the second, was alignment. You know, getting at the patient care and education piece, alignment with other accreditation activities, not just of programs individuals, but institutions like hospitals. The JCI example we just heard is really important. I think the third is that given the pace is moving fast, building on Maria's conversation, you have to walk on the bridge as you build it, to build an evaluation up front, something we probably haven't done very well. In medical education, we often put stuff in place and then we kind of stop without building in program evaluation up front. So those are kind of three themes that struck me from the morning. Were there any other big themes that people heard that they think would be important to capture, kind of overarching themes from the conversation? Yeah, Warren.
What I heard at almost all tables was yes, but. And I think what that's getting at is the issue of implementation. Sort of how do you do it?
Absolutely.
Exact issues of how you do it become really critical to whether or not you move forward. And I think it's, as we were talking about in the forum yesterday, this implementation issue is a key generic issue as we move forward.
Yeah, exactly. Any other kind of overarching themes that struck people? Yeah, Maria.
If I think back to the first forum workshop, the whole idea of the interface between practice and education was one of the sort of threads at the fore. And I think I'm hearing that again today. Yep. In terms of who are the stakeholders that actually inform the accreditation process, and how do we do a better job of ensuring the practice communities at the table.
Yep, great. Yeah, Malcolm.
Just to follow up on that a little bit, you know, one of the commonalities, I think, in most of the discussions at this forum is this alignment issue between educators and the delivery system, obviously a critical one that determines how you frame outcomes. But also, increasingly, we're talking about moving beyond the healthcare delivery, and I emphasize care system, to health and well-being. And so there's really a broader alignment that's necessary on those more distal and important outcomes, I think. And I'm not sure we've given enough consideration to that part of the public, as opposed, I mean, most accrediting bodies have public members now, but to the degree that those public members represent the concepts of health and well-being as opposed to healthcare is an important question.
Yeah. Terrific. Yeah, please, John, you get the last word. How's that working out for you?
It's good to yield sometimes. this whole dialogue is making me think about, I don't know if any of you saw the JAMA piece on the new moral era that was a couple months ago from Don Berwick. And
Yep.
it's interesting here because, he talks about the first era being one of sort of trust in the professional. And then we learned that we couldn't quite trust, and we've gone into this heavy regulatory period that's about distrust and trying to control cost control and quality control everywhere. And the moral era, one of the characteristics, he says, is less. We need to move to less regulation, less mandates, fewer requirements. And I would, in part because those are also contributing to burnout, which is one of our topics here. Now, I'm just thinking, how does this dialogue about sort of more from the regulatory side fit into that kind of burnout of both administrators and professionals?
Yeah, maybe that's an opportunity for the alignment conversation around some things we heard to help with that. Like the examples given in IPE and social determinants might be a place. I think Susan, our first speaker, beautifully talked about what if we had that conversation across accreditors around a common topic that's of importance to us. Well, this has been a terrific conversation. We are going to now take a break until 11:15, and then Neil will call us back to order. Thank you. It was a great session.